Hello friends, today we'll discuss the mechanism of labor. Okay, so we have a fetal call, we have a maternal pelvis. So today आप लोग हम आज डिस्कस करेंगे the mechanism of labor. Okay. Good evening all. Today we'll discuss the mechanism of labor. Okay, mechanism normal labor क्या होता है आज हम सारे डिटेल में पढ़ेंगे. वो लाइव डेमोन्स्ट्रेशन है mechanism normal labor. बिफोर आप नॉर्मल लेबर जाने से पहले आपको जानना चाहिए व्हाट इज द लाई ऑफ अ बेबी. लाई मीन्स रिलेशनशिप ऑफ लॉन्ग एक्सिस. रिमेंबर रिलेशनशिप ऑफ लॉन्ग एक्सिस ऑफ द fetus to the long axis of the, suppose this is the uterus, this is the maternal spine. Okay, this is the maternal spine. Relations of long axis of fetus with the relations of long axis of the centralized uterus or maternal spine. So what are the types of line? It can be a longitudinal line. Okay, suppose the maternal spine and the relations of the fetus spine, it is parallel, so it is called as a longitudinal line. If it is like that 90 degree, there is a transverse line, and if it is oblique, then oblique line or unstable line. Okay, then after that line you have to know the presentation. What is the presentation means? The part of the fetus. Okay, so this is the part, ये part है जो part of the fetus that will occupy the lower pole of the uterus, that is called as, suppose this is the uterus, this is the uterus. Okay, this is the uterus, ये uterus है आपका, और यूट्रस जो यूट्रस का जो पार्ट ऑफ द fetus है जो ऑक्यूपाई करता है लोअर पोल ऑफ यूट्रस एंड प्रेजेंटिंग द पेल्विक ब्रिम, जस्ट ये पेल्विक ब्रिम के अंदर घुसता है. ठीक है, so that is called as presentation. Again, then next is presenting part, most dependent part of the presentation. Again, suppose this is the presentations, but presenting part is, this is, suppose this is the cephalic presentations. So part of the fetus that is occupied the lower pole, here the lower pole it is occupied by the cephalic, that is cephalic presentation. If it is breech, then breech presentations. Okay, this is shoulder presentations. Any other part like that you have to tell. Okay, next is your presenting part. What is the presenting part? Most dependent part of presentations. Dependent part of presentations which overlay the internal os. Suppose internal os के पास कौन सा पार्ट रह रहा है वो presenting part बोलते हैं. ठीक है, so suppose this part is vortex, this is a occiput, this is a face, this is a brow, this is a trach. So if it is vortex, will be in the lower pole of uterus, that is called vortex presenting part. If it is face, you have to know what is attitude. Attitude means flexion. Attitude, relations of different part one and another. So flexion means universal flexion or deflections. Okay, that is the attitude, relation of different part of fetus to one another, position of fetus, the flexion, deflections, extensions. Okay, next is your denominator. What is the denominator? Denominator is, this is the arbitrary bony fixed point on the presenting part. Support this, the vortex is the presenting part, the vortex is the presenting part, arbitrary bony point is your occiput. Okay, again in the face presentation, chin, face presentation, chin है आपका denominator, bony arbitrary bony fixed point on the presenting part which come in relation to, that is quadrant of the maternal pelvis. This is the quadrant of the maternal pelvis. Okay, then brow presentation. In brow present, this frontal eminence is your chin, frontal eminence, this frontal eminence is your denominator. In breech presentation, this sacrum is your denominators, and in the shoulder presentation, this acromion process. Okay, that is your denominator. Next, after that, what is the position? The relationship of the denominator, that means the relationship of the occiput to the maternal pelvis. Suppose if you divide the maternal pelvis, that you will get a 4 quadrant maternal pelvis. 8 position you will get, that is like anterior posterior, that is 4 quadrant with 8 position left. Suppose this is the left side, left occiput will be anterior, left occiput anterior, there is right occiput anterior, right occiput posterior, left occiput posterior, right occiput posterior, left occiput right occiput transverse, left occiput transverse. So what is the mechanism of labor? Now we will study the mechanism of labor. Definition is the series of movement that occur on the हेड. ओके, जो सीरीज ऑफ मूवमेंट होता है इन द हेड में होता है. ठीक है, सीरीज ऑफ मूवमेंट ऑफ द हेड इन द प्रोसेस ऑफ अडेप्टेशंस. ओके, जब हम डिलीवरी के जर्नी में थ्रू में जाते हैं द पेल्विस, सो दैट द सीरीज ऑफ मूवमेंट ऑकर इन द फीटस हेड, सो दैट द स्मॉलेस्ट, जो फीटस का स्मॉलेस्ट फीटल डायमीटर होता है, दैट विल क्रॉस इजीली थ्रू द लार्जेस्ट डायमीटर द मैटरनल पेल्विस. ओके, सो दैट these are the cardinal movement. What are the cardinal movements? The first cardinal movement is the engagement, then second is the descent and flexions, internal rotations and extensions, restitution, external rotation and expulsion of the flesh. First cardinal movement is your engagement. What is meant by engagement? Engage means when the greatest horizontal plane diameter, that is the biparietal diameter, of the जो मैटरनल पेल्विस का फीटल हेड का बाइपेरिमीटर डायमीटर होता है, द लार्जेस्ट ट्रांसवर्स डायमीटर ऑफ द फीटल हेड that is the by BPD will cross the pelvic brim, that is called as engagement. Okay, when the greatest horizontal diameter जो engagement होता है, usually जो प्राइमी लेडी होते हैं, जो प्राइमी ग्रेविडा होते हैं, उनका जो मैटरनल टोन ज़्यादा अच्छा होता है, तो so that their tone will ज़्यादा अच्छा होता है, तो they will engage at term before onset of labor. But their tone of the maternal uterus, maternal muscles, abdominal wall muscle is weak, so they will engage late fast stage of labor after rupture of membrane. So here the engagement, during engagement you will get a engaging diameter and another is diameter of engagement. So those things that will engage, that will call engaging, fetus head is engaged, so it will engaging, so that is the engaging diameters. Engaging diameter here in this left occipito anterior positions is the suboccipitobregmatic, subocciput and bregma. This is the bregma, this is the bregma, this is the bregma. Okay, so you can see this is the suboccipitobregmatic diameter, that is the AP diameter, and the biparietal and transverse diameter, that is the biparietal diameters. Okay, so this is the engaging diameter because this head is engaging into the maternal pelvis, and diameter of engagement is the diameter in which fetus is engaged in maternal pelvis. What is the diameter of maternal pelvis? If it is LOA position, in LOA position it will engage in the right oblique diameters. Okay, this is the right sacroiliac joint, right oblique diameters of the maternal pelvis. Okay, so you can see this is the right oblique diameters. Okay, this is the right sacroiliac joint I am holding, so it like in mirror it will be different. This is the right sacroiliac joint to right iliopubic eminence, the right sacroiliac joint to right iliopubic eminence, that is the right oblique diameter. So during the engagement, okay, in left occipito anterior positions, okay, in the left occipito anterior positions, the diameter of engagement is right occipito transverse opposite. Okay, so engaging diameter here is the suboccipitobregmatic diameter, that is your subocciput. If it is a flexion head, so it is a suboccipitobregma, suboccipitobregmatic in the AP diameter engagement, and transverse diameter is the biparietal diameters. Okay, so in LOT, AP diameter is suboccipitobregmatic and transverse diameter is biparietal diameter. So usually after engagement the descent will happen, and descent, it is a continuous process with a good uterine contraction. Descent will, for the descent of uterus, for the descent of the fetus head will occur. Okay, so then flexion. After descent, flexion is usually achieved either due to resistance offered by unfolding cervix or pelvic wall or by pelvic floor. What happen? Flexion usually achieved either by resistance, when your pelvic floor muscle will offer resistance, also in left occipito transverse position. Okay, so flexion will happen when pelvic floor offer resistance. Okay, that will cause flexion of the fetal's head. Okay, then after flexion there will be a internal rotation. The basic theory of internal rotation is whichever part of the fetus head will touches fast, that will cause rotations. Okay, suppose here in full flexion head the occiput will touches the pelvic floor, that is the levator ani muscle first, so that will cause rotate anteriorly, so head will rotate anteriorly 2/8 of circle. If it is a LOT, left occipito transverse position, if it is a left occipito transverse position, then head will rotate 2/8 of circle anteriorly. So when head is LOT position, what is the location of the shoulder? Shoulder will be in the AP diameter of the maternal pelvis, that is in the 90 degree to the head. So what happen when head will be rotated 2/8 of circle? So क्या होता है उसमें, जो शोल्डर होता है, जो नेक होता है, टॉर्सन 2/8 को सस्टेन नहीं करता है, so shoulder has to rotate 1/8 of circle at that time. So what happen when internal rotation happen, when whichever part will touches the, that is occiput will touches the maternal pelvic floor, it will rotate. Okay, occiput will rotate anteriorly 2/8 of circle, but that time because everybody you know our head जो है, neck जो है maximum 45 डिग्री टॉर्सन को सस्टेन कर सकता है, बट इस केस में our neck जो है 90 डिग्री रोटेट हो गया, तो 2/8 सर्कल रोटेट हो गया, तो टॉर्सन नहीं सस्टेन कर पाएगा. तब क्या करता है, शोल्डर जो है पहले कैसे था शोल्डर, जब ये रोटेट करेगा 90 डिग्री दैट इज 2/8 ऑफ सर्कल, द शोल्डर जो एंटीरियर पोस्टीरियर डायमीटर में था तो शोल्डर आल्सो रोटेट टुवर्ड्स द 45 degree 1/8 circle toward the internal rotations. Okay, so now shoulder will be coming the from AP diameter to now shoulder will be coming to the right left oblique diameter of the maternal pelvis, the left oblique diameter of the maternal pelvis. Okay, then after internal rotations the occipital will hinge under the pubic symphysis, then crowning will happen. Crowning is the maximum diameter of the, now the crowning you can see the maximum diameter of the fetus pelvis, maximum diameter of the fetal head, that is the bifetal diameter. This is the maximum, the crowning means when maximum diameter of the head stretches the vulval outlet without any recession. If you give a contraction in between the relaxation, the head will not go back, it will be stay there, that is called crowning. The maximum diameter, that is the biparietal diameter, stretches the vulval outlet without any recessions of the head even after contraction is over. Suppose contraction is over, still the head will be in the same stations, that is called as crowning. After crowning, the successive part of the fetal head to be born through stretched vulva, that is first part will deliver is vertex. Okay, after vertex the brow will be delivered. This is vertex, first will deliver the vertex, then brow, this brow part, then the face will deliver. Okay, so this delivery will happen by extension. Okay, you can see the delivery by extension, first delivered by the vertex, then brow, then face. Okay, the delivery will happen. Okay, after that the successive part of delivery happen, then extensions, then restitution. Immediately after delivery the head will be rotate 1/8 of the on twisting of neck happen, that sustained during the internal rotation. जो भी internal rotation के टाइम जो 90 डिग्री रोटेट हुआ था, now 45 डिग्री 1/8 of circle head will rotate passively. This is the passive movement जो रोटेट होगा. तो okay, तो occiput points toward maternal thigh, towards left maternal thigh. Okay, head will rotate 1/8 of circle, so now it will be on the 1/8 will rotate. Then after that external rotations, so now the shoulder will be rotated 1/8 circle. Now the delivery of the shoulder will happen. So, I already told before that shoulder will be in your left oblique diameter, so shoulder will rotate 1/8 of circle in direction opposite to the internal rotation. The same movement will externally visible as externally visible as in the fetal head, that is external rotation of the fetus head, that is 45 degree, that is opposite to the internal rotation, because that will cause release the torsion of the neck torsion, release the neck torsion. Now shoulder, you can see now the shoulder will be come in the AP diameter, shoulder is come in the AP diameter, you can see AP diameters. Okay, anterior posterior diameter. Now the anterior shoulder will be hinged under the pubic symphysis. The delivery of the anterior shoulder occur fast, followed by the posterior shoulder, then anterior followed by posterior, then rest of the body is delivered by the lateral fractions. Okay, so this is the delivery is happening. So these are the cardinal movement I told you. So basically first is the engagement will happen. After engagement there will be descent. This is a continuous process. Flexion there will be flexion will happen. After flexion there will be internal rotation. Whenever whichever part, if it is a flexion head, whichever part which touches the pelvic floor, that will rotate anteriorly. Suppose it is a LOT position, it will rotate 2/8 of circle. If it is a LOA position, it will rotate 1/8 of circle. So LOT position it will rotate 1/8 of circle. When head is rotate 2/8 of circle, the neck क्या होता है, सस्टेन नहीं कर पाता है. जो नेक टॉर्सन होता है 45 डिग्री से ज़्यादा टॉर्सन नहीं सस्टेन कर पाता है. सो शोल्डर क्या होता है, पहले शोल्डर अंडर पोस्टर डायमीटर में रहता है. जब नेक रोटेट हो गया तब क्या करता है, शोल्डर ऑल्सो रोटेट 1/8 ऑफ सर्कल, सेम डायरेक्शन टू द इंटरनल रोटेशन. सो नाउ शोल्डर विल बी कमिंग इन द लेफ्ट ऑब्लिक डायमीटर ऑफ द मैटरनल पेल्विस. Okay, then head of the occiput will hinge under the pubic symphysis. So delivery of the, then crowning will happen. Crowning is not a cardinal movement, remember, very important. Then delivery of the fetus head by extension. First delivery of the vertex, then brow, then face will occur. Then now the shoulder will be in the left left oblique diameter of the maternal pelvis. So then external rotation, restitution of fetal head occur opposite to the internal rotation, that is 1/8 of circle. After that is the visible passive movement. Then after the active movement of the internal shoulder delivery will happen. Shoulder will rotate 1/8 circle opposite the internal rotation. Shoulder will come now shoulder in and epidiameter of the maternal pelvis. The same internal rotation of the shoulder is visible as external rotation of the, ये जो है वो विजिबल होगा एक्सटर्नल रोटेशन ऑफ फीटल हेड, वो बाहर की तरफ दिखेगा एक्सटर्नल रोटेशन होने तरफ. नाउ शोल्डर विल बी इन द आईपी डायमीटर, शोल्डर डिलीवरी बाय एक्सटेंशन, अंडर शोल्डर डिलीवरी, देन पोस्टीरियर, देन लेफ्ट बॉडी बाय lateral flexsions. Okay, thank you. Please like, subscribe if you like this content. Thank you. Good night.